Hi, my name is Sharon Cameron. I'm the Director of Health for the City of Peabody. And with me today is our public health nurse, Chassie Robinson, and Peabody's school nurse leader, Brenda Wolf. 100 years ago, the world saw the great influenza pandemic of 1918, which infected over a third of the world's population and resulted in the death of over 50 million people worldwide. Fortunately, we're not experiencing a flu pandemic this year. However, every year, influenza causes many cases of serious illness requiring hospitalization and tragically even deaths across the United States. As you may have heard, this year's flu season has been particularly challenging, with many more cases of flu and more severe illness than we have seen in the past few years. Hospitals, labs, and doctors' offices report cases of influenza-like illness to the Board of Health. So we know that here in Peabody, we're also experiencing many more cases here than is typical, similar to what is happening across the country. Flu season in Massachusetts traditionally peaks in February and March, but it is possible for us to continue to see cases into April and May. So we wanted to spend a few minutes here today sharing some information with you to help you keep your family and our community healthy during the flu season. Chassie, first off, can you talk to us about some of the symptoms of flu and how people can tell the difference between the flu and the cold or a stomach bug?
Sure. Symptoms of flu usually come on quickly, and they're usually respiratory in nature. We typically define flu-like illness as fever plus 1 to 2 of the following: cough, sore throat, runny nose, headache, muscle body aches, and extreme fatigue. Children sometimes experience vomiting and diarrhea, although that's not typical of flu.
How is flu spread? Is it possible to get the flu from touching things like handrails, tables, or elevator buttons that were touched by a sick person?
Yes, absolutely. When somebody who has flu coughs, talks, or sneezes, little virus droplets go out of the nose or mouth into the air. They can actually be spread for many feet from the person. And sometimes they land on tables, chairs, surfaces, and then if a hand brushes against that, they can pick the virus up. I think scientists say that the flu virus can live on surfaces for up to 24 hours.
And can you tell me about how long people can shed flu virus?
Yes, people are usually infectious 1 to 2 days before their symptoms even begin. And generally they are infectious for 5 to 7 days after their symptoms begin. Sometimes we call children super spreaders because they can spread the virus for longer than 7 days.
So that's why it's really important that people stay home when they're not feeling well. Brenda, I know you get a lot of calls from parents who are wondering, when is it okay for a sick child to return back to school? Can you talk to us about that?
Sure. We do have some guidelines for the nurses to go by when they receive a call from a parent, and typically we advise the parent to keep the child home if they have had a fever within the last 24 hours of 100 or more, if they've had any vomiting or diarrhea more than once in the last 24-hour period of time, if they've had a really bad cold where they have a productive cough and an excessive running nose, if they have a sore throat that's been present for more than 24 hours, and or if they've been diagnosed with strep throat, we advise for the child to stay home for at least 24 hours after the antibiotic has started and or after the child has received 3 doses. And then the last area that we focus in on is the eyes. If there's any inflammation in the eye area that has any drainage, or if there's any crusty drainage, again, we advise for the parent to seek medical advice. It could be conjunctivitis, have that ruled out, treated prior to them returning to school. And in regards to returning to school, we advise the parents that the child does need to be fever-free, that is without Tylenol or Motrin for a 24-hour period of time, as well as, if your child feels well enough to return to school. Sometimes, that cough just might be so productive and or nagging enough where it's going to drain them and they just don't feel well enough to be in the classroom. As well as even having just a really bad cold with just a runny nose.
Chassie, are there some people who are more at risk for having a severe result from the flu?
Yes, absolutely. Although anyone can get the flu, especially healthy people, complications can occur in anybody at any age. But there are some groups of people who are at increased risk. So people over 65 years of age, pregnant women, and children. And then also individuals who have chronic health conditions like diabetes, heart disease, and asthma are at increased risk for complications like pneumonia and other.
So Brenda, talk to us about what do you do if you get sick with the flu? How do you care for yourself? How do you care for a family member who might get sick with the flu without getting sick yourself?
So as Chassie just mentioned, if you're very sick, if you're pregnant, 65 or older, and or have any chronic medical conditions, you're going to want to call the doctor. If you don't have any of the above mentioned, then you can just stay home, rest, get plenty of fluid, and try to avoid contact with people within the home. And as far as how to care for somebody that may have the flu, you yourself want to avoid close contact with that person, avoid face-to-face contact. You're going to want to, again, do frequent hand washing with soap and water if available. If soap and water is not available and you've touched a surface that the infected person may have sneezed upon or coughed upon, you can use an alcohol-based hand sanitizer. And most importantly, you want to, again, just wash hands and avoid close contact.
Chassie, how does the doctor's office treat people who might have the flu?
Some doctors diagnose the flu just on reported symptoms over the phone. However, if somebody does have pre-existing medical conditions and are at high risk for complications, sometimes the doctor will request that they come into the office to be tested. It's important to call before you go. The doctor's office may want you to wear a mask when you walk in if you're coughing, sneezing. And sometimes when they do the test, it comes back positive, and they may recommend that a person takes an antiviral like Tamiflu. They usually only recommend Tamiflu if the symptom onset has been within about 2 days. And it's important for people to remember to take the medicine as prescribed.
As I mentioned, Chassie, Peabody has seen an increased number of flu cases this season. Can you give us an overview of what's happened across the state?
Absolutely. Every year the State Health Department monitors influenza-like illness across the state and issues weekly reports to local health departments. So we receive those weekly reports. And what we can see is that there was more flu-like activity throughout the state and earlier in the season than we would typically see throughout the state. And Peabody has seen a similar trend.
And I understand that the entire state is really seeing an increase in flu activity at this time.
That's right. When we look at the geographical distribution of flu-like activity, we're seeing it throughout the state. It's increased, but particularly in the northeast and southeast parts of the state.
So the Centers for Disease Control tells us that one of the most important preventative measures we can take is to get a flu shot every season. Chassie, I know that over this current flu season, you've conducted over 30 flu clinics. You've been out in every school. You've been out in a lot of places in the community. And recently, last week, you had a regional flu clinic with the other public health nurses from the North Shore. So I think it's important for people to know that flu vaccine is still widely available, and it is not too late to get a flu shot, and in fact it's recommended. So I know a lot of people have heard that this year's flu shot has offered less protection than the flu vaccine in previous years. Can you talk to us about why that is and help clear up any misconceptions about the flu vaccine?
Sure. So every year a flu vaccine is created based on scientists' projections about what type of circulating viruses we'll see in the community. They usually pick 3 to 4 strains, 2A strains, 2B strains, and they put those into the vaccine. Some years the flu vaccine is more effective than other years, and that depends largely on how the vaccine is made and what the circulating viruses are. It's not a perfect vaccine, but it's still the best protection we have against the flu. Sometimes at our public flu clinics we hear from people who say they don't want to get the flu shot because they don't want it to cause the flu. And we usually say that sometimes there's this misconception that people can get the flu from the flu shot because sometimes when you get the flu shot you have a sore arm, you might have soreness or redness at the site of injection, and you might have some very mild symptoms that resemble the flu. So you might have a low-grade fever, might have some achiness. And we try to remind people that that is the body's immune system kicking into gear when you get the vaccine. The body starts to produce antibodies, so when you come in contact with the real flu later on in the season, you'll have protection. It takes 2 weeks for the body to develop a full amount of immunity to the vaccine. And in that time, a person can come in contact with other viruses and could pick up the cold. So it's really important that people, even if they've gotten a flu shot, just wash their hands routinely and stay away from people who are ill.
This has been a difficult flu season. We hope that the information we've shared with you today will help you understand how better to protect your family during the flu season. And remember, it's not too late to get a flu shot. We have plenty of vaccine available at the Peabody Health Department, so if you still need a flu shot, please give us a call. And on behalf of the Peabody Health Department, I want to thank you for your time and give you our best wishes for continued good health in the year ahead.